Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to cover prevention of repetitive strain injuries. Repetitive strain injuries are also known as repetitive stress injuries and cumulative trauma injuries. They also may be known as occupational overuse injuries and just generally overuse injuries. What I'm going to speak about today is how repetitive strain injuries occur at our computer workstations and how we can prevent those injuries. I already went over ergonomics in an earlier video, so I'm going to have a link to that video at the end of this video and also in the comments section. But I just want to go over some of the general guidelines when we speak about computer workstation ergonomics. You want to have the top of your monitor at eye level. You want to make sure that you have a lumbar support and if all possible to have cervical support. You want to try to keep your wrists in a neutral position. You do not want your wrist to be flexed, to be extended, to be deviated in either direction. You want to try to keep your wrists in a neutral position in line with your forearms. Now, those are just some very basic guidelines for ergonomics, but proper ergonomics helps a great deal in preventing and helping you to recover from a repetitive strain injury. Another key is computer workstation motions. I have a video about this. I'm also going to have a link to it in the comments section, so you could check out that entire video. But what you want to do is take frequently calculated breaks. Schedule your breaks every 15 or 20 minutes. Stand up, close your eyes, or focus on an object that is far away, and you could perform neck motions, shoulder motions, elbow motions, spinal motions, wrist motions, hand motions, finger motions, anything to break the static positioning and to get the blood flowing to the muscles. You want to make sure that you are not in one position for too long. Now, these regularly scheduled breaks, these are very short breaks. I call them micro breaks. So they might only last 30 seconds. And after you have, say you performed your neck motions, you want to perform these motions very slowly in a controlled manner. And never perform any motion that elicits symptoms or intensifies symptoms. Always make sure that you move through a pain-free range of motion. But say, for example, you are performing neck motions where you're bending your head side to side. Once you have completed those motions, then you sit down in proper posture and you get back to work. And then you take your next scheduled break, which could be again 15 or 20 minutes away. At the top of the hour, get up, walk around, take a short break, even if it's 1 minute or 2 minutes. 5 minutes is even better, but get up, walk around, get the blood flowing to all the muscles that are tight and that you haven't been using when you have been sitting down. You can also perform nerve slide exercises. Nerve slide exercises are also known as nerve glides and neural mobilization. They are non-resistance and non-exertion motion exercises that help to lessen nerve entrapment or nerve impingement. These motions are very specific for each nerve. They will help you to lessen the possibility of acquiring a workstation-related nerve entrapment injury. Another key that you can use to help yourself in prevention of these types of injuries is hydration. We need to drink plenty of water. The human body relies on hydration. Drink water throughout the day. Just take small sips. This will make you have to go to the restroom maybe once an hour, once every 2 hours. So during one of your regularly scheduled breaks, get up, walk to the restroom. But as you are walking around or walking to the restroom and walking back from the restroom, you are breaking the static positioning that you are seated in. So hydration has multiple uses. Obviously, it's going to supply you with the water that you need, but it's also going to force you to have to take breaks where you have to get up and walk around. Repetitive strain injuries usually have an insidious onset. They are not a trauma, say if you fall down or if you lift something and you feel the pain right away. The insidious onset is slow, and it comes on where you start to feel the symptoms a little bit, and then maybe the symptoms decrease, but then they come back and they're more frequent and they're more intense till they get to a point where they are constant or almost constant and the pain is intense. This is very performance limiting. This can lead to many different conditions. If one area is not working right, then another area has to take a greater workload, and it just builds from there. Now, repetitive strain injuries, they are preventable and they are manageable, and you can recover from a repetitive strain injury. That is the reason that I went over all of the factors that I stated earlier, where I spoke about the ergonomics. Now, some people say, what is ergonomics? I define ergonomics as a body position or body positioning that maximizes efficiency and lessens the possibility of injury. But you want to have proper ergonomics. You want to make sure that you perform motions while you're at your computer workstation, take frequent breaks, and make sure that you hydrate. These are some basic factors that are going to help to lower the possibility of acquiring a repetitive strain injury. Repetitive strain injuries can be nerve entrapments, they can be ligament sprains, they can be tendinopathies, and they can also be muscle strains, or they can be a combination of those factors. When we are performing repetitive motions, a muscle strength imbalance occurs, and the opposing muscles of the motions that we are doing, they become overpowered and weak, and this can lead to an injury in the muscles that are not being used, and the muscles that are overpowered, inhibited, and weak, or the muscles that are being repetitively used. So that is why it's very important to make sure that you take frequently scheduled breaks and you move these joints and you move these muscles and you keep blood flowing to all of the muscles, especially the antagonistic muscles of the muscles that are frequently being used when we are mousing and when we are keyboarding. Repetitive strain injuries can be painful and performance limiting. So do everything you can to prevent these injuries and do everything you can to recover from these injuries. You want to use proper ergonomics, like I stated before. You want to make sure that you do motions and take frequently scheduled breaks while you're doing computer work, and you obviously want to hydrate. These 4 simple things are just some very fundamental keys to helping to prevent these types of injuries. Thank you for viewing today's episode of Dr. Ozello Sports Medicine Report. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Please visit my website, championshipchiropractic.com, where you can get additional information on my book, and you can also link to my blog. My blog contains articles about injury prevention, about sports medicine, spine health, and fitness. Please feel free to like this video. If you have feedback, suggestions, or questions, please leave them in the comments section below. You can subscribe to my YouTube page. Dr. Donald A. Ozello, DC is the name of my page. If you are watching this video, you are on my page. And please remember to train hard, train smart, get adequate rest between training sessions, utilize nutritional and supplementation strategies that work for you, stay injury-free, and accomplish your goals.